Hi, my name is Kara Brown and I'm here for the final head to toe assessment. I've washed my hands and I've closed the door for patient privacy. Hi, my name is Kara.
Hi, my name's Olivia. My date of birth was 8/31/04. I'm here for the head to toe final and I'm here at the makeshift clinic.
Okay, well, as we get started, I'm going to go ahead and put a pillow under your arm and check your blood pressure, okay? Move this back. Okay. Okay, your blood pressure is really good. Thank you. I'll get this off you so you're comfortable. Okay, if you would, as we continue, if you would go ahead and take off your glasses and we'll start with your eyes first. Okay, so what I'm noticing right now is your eyes are symmetric and even. Your eyebrows and eyelashes are full. There's no signs of scaling or lesions. You look straight at me, and your sclera is white and your cornea is clear. And if you just pull down your eyes, that's fine. So I see that the conjunctiva is pink with no signs of discharge or anything. Okay, I'm gonna just measure your eyes right quick and get my pen light out. And we're gonna do the other eye. Okay, now if you just look straight, I'm gonna shine the light at your eyes from the side. Okay, we're gonna do this side. And we're going to note that the pupils are equal, reactive, and consensual to light bilaterally. Okay, and the next thing is I'm going to look at your ears, and I see that the ears are symmetrical, and I don't see any deformities noted. They're warm and dry to the touch, and there's no signs of drainage from either ear. So if you just open your mouth for me, I'm going to get my pen light out. Okay, and you put your tongue up. Okay. Look at the other side and just go ahead and, move that down so I can see your teeth. Okay, perfect. So we know that the oral mucosa is pink and moist, that there's no lesions or sores noted. Lips are pink and dry, no lesions, no cracking. The gums are pink, no signs of redness, and there's no signs of dental caries noted either, and the gums are below the tooth line. Okay, so I'm going to touch your neck. And I'm going to note that your trachea is midline. Okay, so I'm going to check your pulse. And we're going to check your pulse on this side. We're going to note that the carotid pulse is a +2 left and right. Okay, so now if you would, I'm going to go ahead and just touch your skin right here and notice that skin turgor is brisk, which is also a good thing. So now we'll look at your arms. If you'd like your glasses back on, you can have those back on. So I'm going to look at your skin on your arms real quick. And I'm going to note that the skin is pinkish tan in color. Skin is warm and dry and smooth to the touch. I'm going to check your pulses. Radial pulses are at a +2 bilaterally. If you would grasp my 2 fingers. Okay. Grip strength is at a +5 bilaterally. We'll look at your nails. And we're going to note that the nails there's no signs of clubbing. Nails are firmly attached. Capillary refill is at a less than 3 noted. Okay, so now I'm going to look at your legs. I'm going to put your legs up just a little bit so we can see those on camera. And what I see is that the skin is pinkish tan in color. Skin is warm and dry, and it's smooth in texture. I'm going to press for 5 seconds, okay, just on your legs. 2. And we know that pretibial edema is at a 0. Okay, I'm going to check your pedal pulses. So if you could just bend your knees just a shade bit for me so we can show that I am checking your pedal pulses. and they're at a +2 bilaterally. And if you would push down on with your feet, okay, so that your dorsal pedal reflex is at a +5 in strength. Okay, let me wash my hands off. Okay, we're gonna listen to your lungs next. And what I wanna do is, if we could just look front to back and just stick on this side so we can be seen on camera. And note anterior, posterior is less than transverse in measurements. Okay, if you would take a deep breath for me. Okay, and we're gonna do that the chest rises and falls equally. Okay, I'm gonna listen to your lungs. If you would just take a deep breath as I move this stethoscope around. Okay, deep breath. Okay, we're going to go to this side. Okay. And we'll go over here. Okay, and if you could, I'm just going to go under your shirt. If you want to just lift it up for me so I can listen under your shirt. Okay. Okay, and on this side. Okay, now we're gonna, if you could just turn a little bit so we can be on camera, so we can check your, listen to your lungs on your back. And we'll scoot up your shirt just a little bit, okay? Okay, if you would just take a deep breath. Okay, and again. Okay. Okay, I'm gonna come under your bra here. Okay, and I'm gonna go under your arm, okay? Okay, so we'll, breath sounds are equal bilaterally, are clear. There's no adventitious sounds heard, anterior, posterior, or lateral, no wheezing, no rhonchi, and no rails heard, okay? So what I'm gonna do is listen to your heart next. So if you would, I'm just gonna move your shirt. I just wanna look at your chest from the side, and I'm gonna see that there's no lifts noted. And I'm gonna go ahead and listen to your heart, okay, in different locations as I move around. Okay, you can just breathe normally. Okay. So we're gonna go to the second intercostal space for your aortic. Okay. And then we're gonna go to the second on the left for your pulmonic. Okay, we're gonna go to the third space for your herbs. And then we'll go to the fourth for the tricuspid. And I'm gonna go under your shirt so I can listen. And I'm gonna listen for 1 full minute at the fifth intercostal space so I can listen to your heart and check your pulse. Okay, so your pulse is good at 68. I'm just going to turn around this my stethoscope around and listen again. Okay, and I'll keep you covered. That's at the fifth intercostal space at the mitral. Okay, so now we're going to go down to the fourth intercostal space. Then we're going to move up to the third for the herbs. Then we're going to go to the second intercostal space for pulmonic. And we're going to go over the second intercostal space for the aortic. Okay. So your heart rate is 68, which is very good. There's S1 and S2 heard, no S3 and no S4 noted, and no murmurs noted. So if you could, now I'm going to have you just lay back. So we'll keep you covered, and I'm going to look at your abdomen. Okay. So let's see if we can see that. Okay. So I'm just going to look at you from the side. And I'm going to say that there's no peristalsis noted, umbilical, center, and midline, no drainage, and no redness noted. Okay, now I'm going to just listen to your abdomen. Okay, in 4 different sections. Okay. Okay, so we know that vowel sounds in all 4 quadrants are normoactive. Now right now I'm going to go ahead and touch your abdomen, okay, with just one hand, and let me know if anything hurts you.
No. 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 No.
Okay, so there's no pain or tenderness noted with palpitation, and we're going to go a little deeper with 2 hands this time.
No. 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 No.
Okay, so there's no pain or tenderness noted, nor organomegalia noted with abdominal palpitations. Okay, so I'm going to cover you back up. So if you would go ahead and just stand up for me. Go ahead and keep you, and put your back to the camera so we can look at your spine. And we'll put your shirt up if you would for me, please. I'll hold this for you. Okay. All right. So if you got your sheet, all right, perfect. Thank you. No, I've got it. Thank you. Okay, is anything hurting you?
No.
No. Okay, the skin is warm and dry to the touch. On palpation, no pain or tenderness noted. Nothing hurts you?
No.
Okay, and if you would just lean forward. So we're going to note that the spine is midline, no signs of kyphosis, scoliosis, or lordosis noted. Okay, if you would have a seat. And do you have any questions for me?
No, ma'am.
No? Okay, well, thank you so much for participating. I'm going to go ahead and wash my hands and document.
Thank you.
You.